DPI stands for Digital Public Infrastructure. So you can think of them as fundamental blocks. These could be things like payments or identity that transcend use cases and usage scenarios.
Public organizations and non-profits often have low budgets. So the ability to leverage the work that's been done in delivering digital public infrastructure and digital public good products is possible for organizations to have world-class solutions without having to spend a lot.
So once you have a DPI, then you can have businesses, you can have your public delivery systems all being built on the back of digital products which can use the infrastructure which is available. Now, this has a lot of advantages because you're giving in infrastructure, so a lot of businesses can start leveraging that. You don't need to build things from scratch. You're getting something which is well tried and tested and then can be rolled out. And governments can really provide scale, I think, on the back of this.
Bahmni is essentially an open source electronic medical record and hospital management information system. It has grown from being used in one hospital to more than 500 sites across 51 countries.
We are a pediatric specialized hospital. We see about 20,000 children from different parts of the country. Bahmni helps us to keep the information in one place so that it's easily accessible.
With the old paper system, there are quite a number of problems that we actually faced. Number one being security of the patient's information. Secondly, patient confidentiality. The other thing I would say is that it was very difficult for us to actually access patient's data, in that if you've seen a patient for a very long time, you have to flip through tons and tons of papers before you actually get to the information that you need.
We used to buy paper files, so they were actually costing us about $5 for each file. So that's a cost of about $1,000 a day in terms of funds that have been saved because we have more resources and improved quality of care for patients. Now we are using Bahmni.
In the context of building something like Bahmni, we needed to be led by doctors, nurses, hospital staff who are actually going to need to use the software. Rather than trying to build something from scratch, we decided to build on the work of others, right? So that's when we decided to start with OpenMRS. We had to build something on top of it which would make it usable in the context of where it was we expected it to be used. We decided to use open standards to have these systems kind of talk to each other. Open source by definition means that you have access to the source code, which means that anyone can inspect, see the features, and also know what are the flaws and the limitations of that software. The way it is designed, it's designed to protect healthcare data, which is really important, both at rest while it is stored as well as in transit when it's being seen on user devices or sent over the cloud. The design keeps evolving as we react to users' feedback, as we understand the different contexts in which Bahmni is being used.
Because cloud platforms allow you to quickly spin up virtual machines that use operating systems like Ubuntu and others, you can quickly deploy open source solutions. I think it's very important that other CTOs look at the implementation partner that they're going to use for projects like this. We've had a great experience with Thoughtworks, but it's very important to have a deployment and development partner that you trust and that you can truly partner with.
Governments don't need to reinvent the wheel every time. They can choose solutions that are already out there and essentially build on top of it to really accelerate digital adoption in their particular countries.
For any government, DPGs and DPIs are an absolutely great way in which they can provide the infrastructure, do the service delivery of goods across the whole society.